Hi, I'm Jean Schumacher, founder of simplyplantbased.net, where I've got a bunch of programs to help you to change your health destiny from losing weight to continuing education and now corporate wellness. And with me tonight is my partner in crime, Dr. Debra Shapiro. She has a new view of food, and I'm so excited tonight. Not only do we have a program coming up, it's called the Pregnancy Advantage. This is where Dr. Shapiro and I are putting our heads together and coming up with a program to help women get their bodies pregnant ready, or for women who are having trouble getting pregnant. So we want to help them too. So thank you, Dr. Shapiro, for being here tonight.
Thank you, Jean. It's so wonderful to work with you and to see you and to know everything that you're doing. It's fantastic. And I'm very excited about the Pregnancy Advantage because as an OBGYN, I've really dedicated my life to trying to keep women healthy through their pregnancy and have healthier babies. And when I've been learning more and more about how important it is to grow a baby inside of a body that's in optimal health, to have the healthiest child possible, I've learned about epigenetics, which we'll talk about a little bit later. I'm just very excited about this program. That's what it's all about, just getting women ready in the best possible shape to have the healthiest pregnancy and the healthiest offspring.
Right? And
Yes.
tonight, you're going to be sharing a presentation that you did at a Veg Fest.
Yes, this was so exciting. I was asked to present for the first time at the San Francisco World Veg Fest, which was in October. And because October was the end of Breast Cancer Awareness Month, I talked about breast cancer. So I made it all around issues in women's health. So we talked about three things, actually: breast cancer, heart disease, and a little bit about epigenetics. So all of this is fantastic. So it's topics in women's health and plant-based, as it relates to plant-based nutrition.
So we're going to dive into that.
Yes,
Ready?
I'm excited, yes. So thank you. This is such a wonderful opportunity. My talk is titled Plant-Based Nutrition Topics in Women's Health, and I am a vegan lifestyle coach and educator. I'm a board-certified OBGYN, and I'm a certified health coach, and I also work part-time as a OBGYN at Genentech for Premise Health for their clients, for the employees there. So I really feel that women play an enormous role in keeping communities healthy. I think women, I've always felt this way, and this is why I really went into OBGYN in the first place, is because I felt that women really set the health tone for their families, because obviously in homosexual male households, it's not true. But for a lot of households still, mothers decide, whether or not to breastfeed and for how long, and they make decisions about what to feed their young children. And also I really feel that the habits around food that are formed when we're very young often determine what we enjoy eating as adults, and our feelings around food, not just the habits, but also just the feelings around food as well. And maternal health certainly influences a child's health. And now that also, as we talk about later with epigenetics, what the environment is for the embryo and the fetus growing inside of your womb not only determines that child's health, but your grandchildren's health. So it's all very, very important. And so I dedicate this talk to anyone who has a mother, who wants to be a mother, or who had a mother. And in the spirit of inclusivity, I feel that men can certainly be mothers too. My mother was ill for most of her life with me and died young. And I think that really played a huge role in my decision to go into medicine and obstetrics also. I know how important mothers are. And so I've dedicated my life to try to keep mothers safe and healthy for their children.
Well, it's true about the habits of food. I think these are formed not just in childhood, but I think you see it a lot in families, because I think you see not just genetics in families, but food in families too.
Oh, absolutely. There are certain communities where they really just eat a lot of fried meats. Certain ethnicities really that's part of their culture, just to eat more fried meat. And when I was working at Kaiser, another institution, I would see a lot of these patients, and by the time they got to be about 50 or 55, they were all on about 4 or 5 different medications. They all had type 2 diabetes, they all had hypertension, they all had high cholesterol. And they would invariably say to me, yes, it runs in my family. And I just kept wanting to say, no, it's the recipes that run in your family.
It's the food.
It's the food, as Dr. McDougall always says, it's the food. And so does Dr. Clapper. It's the food, it's the food, it's always been the food. So we're going to talk today about 3 different topics of immense concern to women. breast cancer, and this soy versus dairy, this whole myth about soy, I really would love to put that to rest. There's just too many times you just hear from everyone who's had breast cancer, or who's worried about breast cancer. Oh, my doctor said I can't have soy, or someone who's had breast cancer. Oh, I can't have soy. I want to cut through the nonsense about that. And heart disease, which is the number one killer of women. It's not only preventable, but also reversible. Our number one killer is reversible. And that's just stunning news when you think about how much suffering there is that's unnecessary in this world. And then epigenetics, which is really how your genes are not your destiny, but how your decisions affect not only your children and also your grandchildren, as I mentioned earlier. So what epigenetics is, it's a relatively new science. We've only from the late 20th century, early 21st century, so it's brand spanking new. Breast cancer, this is the most common cancer in women after skin cancer. Your lifetime risk is 1 in 8, or about 12.5, and I've heard maybe 13% risk. There are about 4 million women in the United States with breast cancer now, and over 40,000 women die annually from breast cancer, and it's often quite young women as well. So, really,
but I think a lot of it is preventable. I mean, if we start to change what we're doing with our food, with our health, when we start to change this, I think we can eliminate this, easily within our lifetime.
Possibly not eliminate 100%, of course, but we feel that 40 to 70% of cancers are related to diet and lifestyle. So the body has a few ways of protecting itself from cancer, and we're going to talk about some of these ways through food and lifestyle. The Physicians Committee for Responsible Medicine, in light of it being National Breast Cancer Awareness Month, came up with what I'm going to be talking about soon, which is these, I think, 4 steps that you can take that will definitely reduce your risk of breast cancer. And one of them is with diet.
Excellent.
Yes. So the first lifestyle change that you should adopt to lower your risk of breast cancer is to eat a plant-based diet. And it's never too late to start, and it's never too early to start. After weaning, a baby can go right onto a plant-based diet. That's recommended by the Kaiser Foundation, but also by the Academy of Nutrition and Dietetics. Is appropriate for all stages of life. What is a plant-based diet? So a plant-based diet is a diet centered around whole plant foods, as minimally processed or unprocessed and unrefined as possible. So colorful, non-starchy vegetables, fruits, whole grains, legumes, which are beans, peas, lentils, and chickpeas, and then tubers, starchy vegetables, nuts and seeds, spices and herbs, and mushrooms, edible fungi, which have micronutrients. So I put phytonutrients and antioxidants. This is what constitutes a whole plant food diet. So are there any specific foods that would help prevent breast cancer? And there are, actually. Ground flax contains lignans, and this lignans is different than lignins. So there is a chemical, lignans, there's a fibrous part of a plant, or lignins, but these are lignans, and they are phytonutrient that actually lowers estrogen levels. And if you could have a tablespoon of ground flax every day, it's also high in omega-3 fatty acids, so a tablespoon of ground flax would be great to have every day. And that's part of Dr. Greger's Daily Dozen. So that's a wonderful food to have. You can sprinkle it in your oatmeal or in your overnight oats, or put it in a smoothie, or sprinkle it on your salad. And it doesn't really taste like anything, and you can grind it up as you need it. Cruciferous vegetables, sulforaphane is a very powerful antioxidant and anti-cancer bioactive that's found in cruciferous vegetables. But it's interesting about sulforaphane, it actually has to be created. So the reason that the plant makes sulforaphane is actually to ward off bugs that might be eating it. So a little insect might be nibbling on cruciferous vegetable and develop this myrosinase, the enzyme that creates sulforaphane, is activated by the crunching up the cell walls, and really tastes like broccoli. So the bug goes away. So this is actually a defense against invaders. But sulforaphane is very active for humans, and broccoli is a good form. Also, broccoli sprouts have more sulforaphane in them. If you eat the vegetable raw, then just in the act of chewing it up and having it be in your stomach for a while, you will get sulforaphane, because sulforaphane is created when the precursor, which is like a glucosinolate, meets up with myrosinase, which is the enzyme, and it creates sulforaphane. But if you're going to cook your vegetables, then you're destroying the myrosinase. So if you cut up your vegetables, or don't even cut them, like you just take your broccoli and stick it in a steamer or your Instant Pot and cook it, you're killing the myrosinase, you're destroying the myrosinase, not killing it because it's not alive, but you're destroying the myrosinase, which is a heat-sensitive enzyme, and you will not get the sulforaphane that you expect, that you want. So the way to get it, if you're going to cook your vegetable, is to cut it up first, and then wait for about 45 minutes until the myrosinase can act on the precursor and develop the sulforaphane. If you don't have time to do that, or if you're using a frozen broccoli that's been flash frozen, that's been cooked when it's at the height of its freshness, which is great, and then frozen, but the problem is they've most likely destroyed the myrosinase, so you're not going to have the sulforaphane in that. So if you're using cooked vegetables, frozen vegetables, or you're cooking it without having time to wait, then put a pinch of mustard powder on the vegetables, because mustard is also a cruciferous vegetable. The other one you could use would be some horseradish, also a cruciferous vegetable, and that will have the myrosinase that you need to develop the sulforaphane. Alternatively, and what I do is I often have my cooked vegetables with some raw vegetables. So if you put your broccoli with some fresh broccoli sprouts, or if you put it on a bed of arugula, then you're getting cruciferous vegetables. So the cruciferous vegetable will have the active myrosinase, and then you'll have sulforaphane. So one other thing I wanted to say about broccoli sprouts is that they've done some studies with broccoli sprouts and autism. And it's incredible that the mothers really do say that the children with autism actually show improvement when they're eating cruciferous vegetables and broccoli sprouts in particular, because they're very high in sulforaphane. So sulforaphane is really something bioactive in your brain.
Wow.
Yeah.
I did not know that, so I'm learning tonight.
Oh,
So,
I'm so happy. What was new?
Cutting up the broccoli.
Oh,
and
yeah,
letting
yeah.
it sit.
I know. It's so important because, so Dr. Greger says you have to sort of hack and hold or chop and chill, so that's a reason also to do some batch cooking. You get these vegetables, the broccoli and the cauliflower and the Brussels sprouts and the kale. You have to cut it up and then wait, or just eat it raw. Eat it raw if you like. I love putting raw broccoli, especially if it's organic and it's broccolini. Put it raw on your salad. It's fantastic. Yeah. But something I remember cooking up a cauliflower, boiling the cauliflower, putting it in my Vitamix and making cauliflower soup. Well, I lost the sulforaphane. So the way to do it is to put the cauliflower in your Vitamix first and then wait and then heat it up.
Okay.
And it's a whole different thing.
It's a new ballgame. What is so important about lowering your estrogen levels with the ground flax?
Own estrogen feeds cancer. It feeds breast cancer and it feeds endometrial cancer. And it feeds actually prostate cancer too. So I think that the ground flax is also helpful for men as well to lower their risk of prostate cancer. But for women, it's definitely supposedly lowers your risk of breast cancer.
Well, and ground flax is also great to help anybody who's constipated. Wow. It'll help things flow nicely. Yes.
And flax, just thinking about using it as a fiber, then you can also just use flax in crackers, just the whole flax. The thing about having the whole flax is it is just a fiber that's going to help you to get your bowels moving, but you're not going to be able to absorb the omega-3s. You're not going to be able to get any DHA and EPA from it, so you need to grind it. The same with chia seeds. I used to think that chia seeds would be fine if you just had them whole because they're great as a fiber, but it turns out also they've done studies, and if you really want to measure the amount of omega-3s that you got in your blood, the DHA and EPA, then you're going to grind up your own chia as well.
I did not know that too.
Yeah,
I'm learning lots tonight.
I'm so happy. You know so much, so it's really thrilling if I can actually tell you something. So, more foods that might be really helpful to prevent breast cancer. Mushrooms. So in Dr. Furman's, his G-bombs, these are foods that he feels are particularly important in the nutritarian diet for trying to prevent cancer and for being generally healthy. So greens, beans, onions, and garlic, mushrooms for the micronutrients, berries, and seeds and spices. Mushrooms have micronutrients that are cancer fighting if they are cooked. So if they're raw, they have actually something called a garetine. So we're not talking about lion's mane, different kinds of mushroom that they make into mushroom powders. That's different than these kinds of like button mushrooms or shiitake mushrooms. Do you know what I mean? That they're different.
Right. But the bottom line is you want to cook them.
But the mushroom powders do not have to be cooked in the same way. That's what I learned, because they're not really the same kind of mushrooms. So there's a certain kind of mushrooms, like the shiitake mushrooms, the button mushrooms, and all those that are wonderful, and they definitely help prevent breast cancer. They do need to be cooked. So when you see mushrooms in a salad bar, I really avoid them. So green tea should really be your, other than water, maybe your beverage of choice. It's very full of antioxidants. It's almost, when you drink green tea, especially if it's when you're actually drinking the tea leaves, then you really are getting a very high antioxidant and a good cancer fighting beverage. So green tea is very helpful. If you have high blood pressure, then hibiscus tea is actually healthy because hibiscus tea has actually been shown to lower blood pressure. But just to reduce your risk of cancer, green tea. And then turmeric. So turmeric is this incredible orange spice. You can see I did a picture of it there in case people haven't really seen it. It is found like this in markets, or you can actually buy it already powdered as an organic powder. It has anti-inflammatory, antioxidant, and anti-tumoral effects. The phytonutrient in turmeric is curcumin. Curcumin is actually being studied to see how it might be used along with chemotherapies to make the chemotherapy even more powerful.
Wow.
Yeah.
Well, I like using the turmeric. I keep it frozen along with
Do
ginger in
too.
my
Yes,
freezer.
me too.
And it just makes it so much easier to work with.
Yep.
Plus, it's also hard to find, to find it organic in the stores. It usually comes out in the fall because it's a root. So it's more, fall seasons that you're going to find it. Come spring, summer, you're not going to find it as readily available.
Interesting.
So I like to buy a bunch in the fall and then put it into...
Just put it in the freezer. It lasts forever, and
It does.
Right, and it's very inexpensive, and it's incredibly powerful. The other thing I might add about turmeric, I don't know if anyone's ever had a burn or a bite or some sort of skin injury or a little minor inflammation in the skin. You can make a paste of turmeric and water, not this kind of turmeric, I don't think, but I use the powder and some either olive oil or water, put that on. I volunteer at the Humane Society, so once I had a pretty bad cat bite and it looked pretty awful on my hand, and I just made a paste and kept it, a little dressing on it overnight, and it was just cleared up. It's incredible. So I've told my patients about it for burns, and it's really helped. So for inflammation, it is very strong. All right. So that's about food. That's one of the ways to lower your risk of breast cancer. Another one is to maintain a healthy weight, because fat cells, and this goes back to flax a little bit. So all of your fat cells they're metabolically active, and they are not only making inflammatory kinds of chemicals, but also estrogen. They're little factories for making estrogen, that you're making your own mammalian estrogen. Your own estrogen fuels breast cancer. Breast cancer cells often have estrogen receptors. Certainly your breast tissue has estrogen receptors. And so having a body mass index, which is your height divided by your weight, is having an ideal body mass index would be best. And that is the 18.5 to 24.9. And that's true for a lot of cancers are related to obesity, right? So, and a lot of other diseases are related to obesity. So there's more than just one reason to try to maintain a healthy body weight. Third way of preventing breast cancer is to have some daily moderate exercise. So briskly walking for 45 to 60 minutes a day would be terrific. If you can do more and more aerobic type exercise where you really get your heart rate up even more, that has additional health benefits for your heart and maybe also to reduce your risk of Alzheimer's. But anything you can do, I don't think it's been studied when people did more than 90 minutes a day, but certainly if you could do 45 to 60, it would be fantastic. Physical exercise definitely improves your immune function, and that may be one of the ways that it helps to reduce your risk of breast cancer.
Wow. I mean, you've got to exercise. I mean, I think that is one of the biggest pieces that most of us, who likes to exercise? I mean, it's just not fun, and it's a huge chunk of your time in your day. But we really need to take that time to make sure that we at least get some brisk walking. Even if you're just doing a half an hour, the more you can, obviously, but if you can just do a minimum of a half an hour, strap that Fitbit on your wrist and start shooting for at least 10,000 steps a day.
Right, exactly.
I
think taking little steps like taking the stairs instead of the elevator, or parking a little further away when you're doing shopping, or just doing more lifting and not putting things in carts, like really deliberately trying to be more physically active, using your body a little bit more anytime. And then if you can put on the radio and listen to some music and dance around for a little bit, that would be great too. Or do a hula hoop, or
me and Bruce
jump a little rope.
We dance in the dark.
Right. Okay? This is the one that people don't like. I know sometimes it's controversial, because there have been some studies that show that moderate alcohol use can be healthful, this possibly reducing the risk of heart disease. There is an antioxidant in grapes, a polyphenol actually in grapes.
Just eat the grape.
Eat the grapes, exactly, organic grapes, yes. Alcohol is a group 1 carcinogen, according to the International Agency for Research on Cancer, and there's no getting around it. If you drink more than 1 serving of alcohol a day, it definitely increases your breast cancer risk. So I would really try to urge people to drink minimally. If you need wine, then have it a few times a week possibly, but I really wouldn't have alcohol every day. There's no benefit to having hard liquor at all.
I think we all know. I mean, you know how bad it makes you feel. I mean, like the hangover that you have the next day. I've just never been a fan. I mean, I just hate feeling that nastiness the next day.
You'd be surprised, though, how many people, maybe it's because I live near the wine country in California, but how many people really do love their wine. And then when news comes out that maybe, a glass of wine a day, 2 glasses for men and 1 glass for women might be healthful in terms of heart disease. People love to hear good news about bad habits, right? So this is another one. But I would, in terms of breast cancer, and this is true especially also if you've had breast cancer, and I actually know quite a few people who have had breast cancer, and they still drink their wine. It says they drink white wine, which has no benefits. But I just would caution people, especially if I had breast cancer, I would just become a teetotaler, and it would be a green teetotaler.
Well, I think the other issue now, we're starting to hear about glyphosate in the wine.
Right.
So that's another huge issue, that the wine is now becoming toxic in that respect because it's got this chemical glyphosate, which is
possibly undoing the effects of resveratrol. We live in a toxic environment now, and it's very hard to navigate. I would think, especially if we start thinking about getting women ready for pregnancy and for raising babies in this environment, I don't envy them. I think it's going to be very, very, it's a treacherous environment, right? They say we're exposed to 800 different chemicals now, most people.
There's even more.
So is it more? All right, so we talked about the 4 different ways that you could reduce your risk of cancer, breast cancer. So let's talk a little bit more about soy versus dairy. Which is best? Because if you have raising a child, you may be finding that your pediatrician is telling you that you need to give your baby, after breast milk, that you need to give them whole milk or cow's milk. And I'm going to try to make the case for why that isn't true and why soy would actually be better. So it turns out that soy actually reduces your risk of breast cancer. There's a 30% reduction of breast cancer when people have had more soy, and even a higher reduction, up to 70% reduction, or 60 or 70%, maybe 60%, when girls start very young, like between 5 and 9, for example. So what do we mean by soy? Because I don't mean soy protein isolate. I don't mean eating those power bars that say soy protein isolate. I'm talking about whole organic soy foods, or minimally processed, like soy milk. I consider that minimally processed. They're cooked and they're strained, and that's that. Tempeh is just fermented soybeans with a culture added to them, so it's actually a living food. And edamame, you can see that there. This is just soybeans in their pod. Tofu, which is also minimally processed. I put this on black beans, the soybeans there, because it's Eden brand, and Eden brand is important because they use non-BPA lined cans, and they also cook their beans with a little bit of kombu, which is a sea vegetable that has a little bit of iodine. So when you're buying already cooked beans, most of them from Eden brand, they'll have a little bit of iodine in them, which is important, especially if you want to have a baby. But we should all get 150 micrograms of iodine in our diet. So this is one way to do it. You can also cook your beans with kombu as well. Or you could have
I was just going to say, because I use the kombu as myself to help get some of the iodine.
Or if you're not completely salt-free, you can use 3/4 teaspoon of iodized salt. Or you can use a shake of kelp powder. You have to be careful because kelp has a lot of iodine, so you don't want to use too much. So a shake of kelp powder on once a day. Or you can use some nori snacks. So I think 2 sheets of nori are supposed to be enough iodine also for the day. So Dr. Greger, I think, has some videos on sources of iodine. The wakame and the arame, they're also sea vegetables that have a good amount of iodine. So a 30% lower risk of breast cancer if you eat more soy, and increasing soy in young girls can reduce their lifetime risk up to 60%, which is really, that's what we were talking about earlier. Like, that's really important, right? And then eating soy after diagnosis helps to prevent a recurrence and decreases mortality. And this is absolutely understood. Everybody understands it, except maybe your oncologist. But nobody can really argue with the science here. They just might not know it.
It's true.
They can't argue with it.
I think that's the part of it, is they just don't understand or know. Because, they just don't know. And I think that's the thing, that, because I've been coaching a lot of people that have been dealing with cancer, and nobody gets training on what, foods or toxins to watch out for, like parabens. Oh my God, nothing.
Right.
They're just immediately put on the medical treadmill, and you're going to start, with whatever your treatment plan or protocol, whether it's surgery, radiation, chemotherapy, you're just put on the medical treadmill, and that's it. There's no discussion. There's no talking about food or changing your diet. So,
and that they're miseducated. I can't tell you how many times I've given this talk. I ask people, have you heard that soy is dangerous in terms of breast cancer? And everybody raises their hand. And then I ask, have you heard it from a physician? And people still raise their hands. Yeah. Most people have just been spreading this rumor among themselves. But some people have definitely heard it from their clinician, especially if they've had breast cancer or if they have breast cancer with estrogen receptors. But let's move on so we can see why, because I'm not just telling you, I actually have some science to back it up.
All right, let's move on.
So let's talk about how soy decreases the risk of breast cancer. In the breast, you have two distinct types of receptors for estrogen. You have alpha receptors and beta receptors. We didn't even know about the beta receptors when I was graduating from medical school. It came out. They just discovered them right after that, actually. So we didn't really know, but now we know. And because we know there are two different types of receptors for estrogen, we've been able to develop drugs that sit in the beta receptor and turn off the growth of breast cancer cells, especially. So drugs like tamoxifen, you might have heard. So when people have had breast cancer and they're being treated, they might be given something called a selective estrogen receptor modulator that sits in the beta receptors. Well, it turns out that soy phytoestrogens, the isoflavones in soy, sit in the beta receptors. So they block the growth promoting effects of estrogen. Another way that soy can decrease the risk of breast cancer is that the isoflavones in soy upregulate the expression of the genes that repair DNA. So one of the ways that we stay healthy is that we can repair damaged DNA. And one of the genes that codes for DNA repair is this BRCA gene. And we know that people sometimes have issues with abnormalities in their BRCA gene. They have mutations in that gene, which makes them more likely to develop breast cancer. And there's some other DNA repair genes that are related to the BRCA gene. Well, isoflavones in soy actually upregulate these genes that repair DNA. So it makes you less likely to develop breast cancer. And this is how it may also help even for people who have genetic mutations in these DNA repair genes. And then the third way that isoflavones work to reduce your risk of breast cancer is they act as aromatase inhibitors. Aromatase, anything that ends in ASE is an enzyme. And what the aromatase does, it causes estrogens to be made from androgens. This is how they're made. Testosterone gets made into estrogen. So another kind of treatment for people with breast cancer are these aromatase inhibitors, right? Like Arimidex, I think people might have heard of. And isoflavones in soy act just like that. Again, to lower the circulating levels of estrogen and reducing your risk of breast cancer.
One of the ways I like to get soy into my diet is I make soy yogurt. And it's so ridiculously easy to make soy yogurt. So I take the West Soy milk.
Yes.
And I take the box, like let's say you're taking 32 ounces. Then you take that, put it into like a blender and add a probiotic like acidophilus.
Mm-hmm.
And the capsules, you'll take 1 capsule per 8 ounce. So if you're using 32 ounces, you'll use 4 capsules. So put that into the blender, blend it up just so that it's spread out through.
Mm-hmm.
Pour it into a glass jar. So you take the glass jars and put them onto the rack, put the rack in the bottom of the Instant Pot, close it up, press the button yogurt, and that's it. 8 hours and 30 minutes, you set it to go, and it goes, you put it on before you go to bed at night,
right.
And in the morning, you have yogurt. It's
fantastic.
That easy.
Right. I was wondering if you check if you're going to use a probiotic, it would be great if you could use one that had lactobacilli. The other one that's excellent for, there are 2 kinds of bacteria that are particularly important for making short chain fatty acids that you really want to get into your gut. And, we could argue about whether eating the bacteria, getting it through your stomach actually gets all the way to your gut, but let's just say some of it does. Then they would be lactobacilli and bifidobacterium. So
Nice.
Those are the 2 that you want. Well, that's fantastic. All right. So yeah, you don't have to spend lots and lots of money on these yogurts that also have fillers and thickeners.
Exactly. They're putting a lot of other chemicals into this, the yogurt. They're adding sugar, they're adding, fruit flavor, and this is pretty simple. And I use that. I use a little bit of like some of the chia seeds to thicken it up if it's still a little bit, liquidy. Right. Once you stop cooking it, then you put it in the refrigerator and it thickens up a little bit more. But you can use some white chia seeds to help thicken it if it's
fantastic.
Thick enough for you. So
fantastic.
There you go.
All right. Thanks for that. So what about dairy? Isn't that healthy? Because you keep hearing about how important dairy is, right? Milk. I grew up with the milk, all those milk ads, milk does a body good,
God.
and the milk mustache ads and everything.
Yes.
So, right. So the interesting thing is because people always tell me, and I've heard this, if I got $1 for every time I heard this, I would
right.
Right? So I kept hearing, doesn't soy have hormones in it? which is funny. So I just told you that, yes, the hormone in soy, the phytoestrogens in soy, you could say maybe they look a little bit like human estrogen, and they sit in these beta receptors. But milk from a cow, that's mammalian milk, that definitely has biologically active female hormones, estrogen and progesterone. And the way we have genetically modified our cattle now to be able to be milked while they're pregnant, we don't want to waste, when a human is pregnant, most of the time, unless she's already lactating because she's been breastfeeding her first child, then usually the milk letdown is suppressed. And we're developing the mechanism to make milk in our breast, but the milk doesn't come down. But once you have the baby, then the milk then comes down. But they've genetically modified the cattle so that they can be milked while they are pregnant. So no time has to be wasted, very little time. They're also pregnant for 9 months, just like humans. But you can imagine if you were milking a cow throughout her pregnancy, how much estrogen and progesterone would be in that milk, especially toward the end of her pregnancy, right? So even without the extra growth factor that they give them, we're talking about the amount of the naturally occurring biologically active hormones that are absolutely sitting in the growth promoting alpha receptors in our breasts. And the estrogen and progesterone in the milk gets concentrated in cheese. So especially if you're eating food like cheese or yogurt even, then you're getting even more concentrated estrogen and progesterone. And high fat dairy is associated with a greater risk of both breast and also prostate cancer. And I didn't say it before, but drinking soy milk can lower your risk of prostate cancer by 70%. That was found in the Adventist 2 Health study.
Well, you're consuming the lactating fluid of another species. What other animal on this planet will consume the lactating fluid of another species except humans?
I've heard that argument, but I agree. We would never think about drinking, in America, would probably not think about drinking dog milk or any other kind of milk except for goat and cow. We do eat sheep's milk cheese, but other cultures are drinking yak milk. Some cultures are drinking camel milk. It is interesting what we're willing to drink. But there certainly are a lot of also ethical considerations about dairy because they're having to impregnate the cow every year. They pull away her baby to be made into veal so that we can take her milk, and also environmental considerations because cows are one of the largest producers of greenhouse gases. And so for a lot of reasons, I think people are moving away from cow's milk dairy. In fact, dairies are closing, and we do have to find a way to transition the farmers away from the dairy industry into something else because they're sort of abandoning their cows. And okay, moving on. What else is wrong with cow's milk? So getting away from the hormones, in addition to the hormones and the problems with the hormones, is we have the animal protein. And animal protein increases something called IGF-1, insulin-like growth factor 1, which causes cells to grow. And while this might be important when you're young and you make enough of it yourself, you certainly do not need it when you're older because it's only making trouble. And it promotes tumor growth. And also, animal protein stimulates this enzyme of aging called mTOR, the target of rapamycin. So we definitely don't want much of this at all. And so you want to really minimize or really get rid of most of your animal protein or all of your animal protein if you can. So cheese also has saturated fat and cholesterol that definitely increase your breast cancer risk as well as other cancers. And cancer cells use cholesterol to make their own estrogen. And cow's milk is often contaminated, and I bet people don't know about this, with something called bovine leukemia virus. And it's actually thought to be responsible, or at least associated with, up to 37% of human breast cancers. They find bovine leukemia virus, and that's in about 100% of our cows now.
100%?
Just about, yes.
Wow.
Or contaminated with bovine leukemia virus, very high amounts. It may be responsible for up to 30% of human breast cancer. I can't imagine there being any good reason to drink. I mean, there are other things that are in that too, like you mentioned glyphosate before, or other chemicals, or pus, or it's just right.
God,
so
that is just so disgusting how much pus.
But they find it right. So don't need to drink it, and there's good reasons why we shouldn't.
Well, I just want to point out, if you go on Dr. McDougall's website, he has a fabulous video on, it's called Marketing Milk and Disease. And it is so powerful. And I strongly recommend that to anybody who really wants to kick the milk habit and break that. Watch this. It's not gross or anything, but the information that you're going to learn from this is powerful.
Excellent. There's some great videos. Of course, Neil Barnard has done a lot of research about dairy, and he has this wonderful book about breaking the cheese addiction, right? Or the cheese trap, it's called, breaking the cheese addiction. And he points out that the reason that we love cheese so much, and I was guilty of this too. I mean, I remember always getting pizza with extra cheese and just, this whole pulling of this cheese. I loved it. Is because cheese contains casomorphins. So these are morphine-like chemicals. They act like morphine in our brain, and they would link the baby calf to its mother. And our milk also has casomorphins, but human casomorphins. But the bovine casomorphins are also biologically active in us, and it makes us really love that cheese. Everybody says they love cheese, and there's a reason for it. You feel good when you're eating cheese.
Well, but it's also condensed. I mean, the cheese is very concentrated milk products. So you're concentrating the casomorphins in this too.
Yes, absolutely. There is one thing that was found, calcium in dairy seemed to decrease colorectal cancer, but you can also get calcium from low oxalate greens. You don't want to get your calcium really from relying too much on supplements, because also they can increase your risk of heart disease. So I would always recommend getting calcium from plant sources: beans, low oxalate greens, almonds, sesame seeds, even molasses, right?
Nice.
Okay. So is there anything else concerning about cow's milk? Well, this was interesting. And I learned this also from listening to one of the lectures from the Physicians Committee for Responsible Medicine. And that was another hormone called 5-alpha-P, or 5-alpha-pregnanedione. So this is another hormone present in milk, and it induces estrogen receptors in breast cancer cells and makes them more sensitive to estrogen. So this is why I can't stand it when I've seen people who've had breast cancer and they're still doing dairy. You're not helping yourself at all. You're taking in something that's going to make you more likely to develop a recurrence, a complication. So it's also a precursor. This is an interesting relationship also between dairy and acne and prostate cancer, because it is a direct precursor of something called dihydrotestosterone, or DHT, which is an androgen that's associated with both acne and prostate cancer.
Wow.
And that's the connection between dairy and acne and prostate cancer and breast cancer too. I think we've covered it. I hope that people are convinced that there's just no reason. If you're worried about breast cancer, there's no reason to continue drinking cow's milk, especially.
Well, I think not just breast cancer, but I think all cancers. Period.
Yes, because of IGF-1, absolutely. And mTOR and aging, yes, there's not much to make it appealing. Pretty pictures of real food.
I know. Eating from the rainbow.
Yes.
I mean, this what stimulates our eyes. If you think about it, our eyes are really focused on color.
That's why we have cones. There are rods and cones in our eyes, but the carnivores do not have them. They only have rods. They see movement. They see grays and they see movement. But we actually are drawn to food because we know that what's colorful is going to have more antioxidants and phytonutrients and bioactives that are going to keep us healthy. So that's what we're drawn to. Ripe vegetables.
Right, and we don't have to sneak up on a strawberry.
No, it's just sitting right there.
It's just sitting right there. Right. We don't have to attack it. We don't have to capture it. Nope, it's right there. And our eyes will pick that up on the horizon, like that bright red patch. We'll see that.
Right, exactly. So, but it's interesting that even when women are so concerned about breast cancer, actually what women die of, or more likely to die of, is heart disease. And that's our number one killer. And even if you have breast cancer, in fact, what you will die of, most likely, is heart disease. So it is the number one cause of death in this country and also around the world, and is overwhelmingly caused by diet and lifestyle. I think 90% of it is caused by diet and lifestyle, which also means that it is preventable to a large extent, and it has also been shown to be reversible.
Well, Dr. Caldwell-Esselstyn showed that.
Yes, and that's what we're going to be talking about for sure, and also Dean Ornish, absolutely.
Okay, let's move on. Let's go.
Here's a graphic that demonstrates the progression of atherosclerosis in the body. So everything from developing a plaque to a full heart attack. So you can see on the left, you're starting to get a buildup of, and this is usually LDL cholesterol, which is gobbled up by a cell called a macrophage that becomes an inflammatory foam cell, and it builds up under the lining, under this very delicate lining. We have one cell layer thick called the endothelium. The endothelium can be thought of like a linoleum, like a perfectly smooth linoleum that lines all of our blood vessels. And when it is intact, then the blood and all the nutrients that are flowing in the blood can flow smoothly through a blood vessel, bringing oxygen to all the tissues downstream. But when the endothelium is damaged by things like cholesterol, fat, salt, sugars, and chemicals, then it gets injured. And cholesterol in particular, especially the LDL cholesterol, can fall under the endothelium and causes plaque. Sometimes they're very stable plaques, but quite often they are inflammatory, young inflammatory plaques. And this is what happens. The cap on the plaque is very thin, and a crystal of LDL cholesterol can come floating down and pierce the delicate cap on the plaque, causing it to rupture, and all of the clotting factors are expelled and all of the inflammatory factors as well, and the cytokines, and you get this enormous blood clot, which is a heart attack and an emergency. And you can see that there'd be no oxygen carrying blood past that clot. And this is a dire emergency and can only be helped by usually a surgeon.
Well, I think one of the bigger pieces here is like men have, and we don't realize, most of us don't anyway, men at least have somewhat of a warning, like erectile dysfunction. It's like the canary in the coal mine.
Exactly, yes.
But women really don't have that. They just drop dead from the heart attack, you know?
Right. Actually, many people, even men too, maybe they're just not paying attention all the time to early signs, but quite often your first heart attack is your last. Sometimes you do see people with angina. So if that plaque doesn't rupture but just gets larger and larger, then it makes the amount of room for blood to flow much narrower. And we'll see that later on when we show that these actually can go both ways. They can develop and they can regress, which is really amazing. Just this idea that if you really just stop injuring your body, that it will revert to its normal healthy state. It wants to, but it's just that every few hours we stick in eggs. In my family where I grew up, we started the day with eggs and cheese. We went on to a meat sandwich for lunch, and at dinner we had meat, and a dessert that was usually a pudding, so that was also dairy. So meat and dairy at every meal, and you could just imagine the cholesterol. Another thing we didn't really talk about, but how one of the ways that LDL cholesterol facilitated to go under that endothelium is by something called TMAO, trimethylamine oxide. And that is caused when you consume animal products that are rich in two things, L-carnitine and choline in eggs and fish, and carnitine in meat and dairy. And it digested and changed by your gut bacteria to be something called trimethylamine, goes to your liver, gets oxidized to trimethylamine oxide. And trimethylamine oxide, we think, is the facilitator of LDL cholesterol getting under the lining of that endothelium. And it also is very inflammatory and can cause cancer as well as metabolic syndrome. So that's another reason to stay away from animal products, choline and carnitine. Wow. And carnitine supplements as well. So do not take carnitine supplements. That's a little bit more about heart disease. Has your doctor ever told you that your heart disease could be reversed? I hope so, because...
Yeah, but it's sad. Most of them, most of the doctors don't know and have not.
Right. You just need a stent. Actually, there was just some data, I think, that just came out, realizing that stents, and the majority of people who get stents, is really not prolonging their life. Because yes, you go in, and we talked about these stable plaques. You can have these stable plaques, and they say, oh, you've got narrowing and you need a stent. But think of all the other blood vessels in your body that have those, that are having narrowing. The progression of the disease is still going on, whether you put, one stent in or two or three, but you're not changing the course. You can still block your stent. So you need to reverse the disease. How do we know that we can reverse the disease? There's actually a mountain of evidence going back to the mid-1900s regarding diet and heart disease. We're just talking about diet and heart disease. I'm not talking about diet and anything else like diabetes or anything else, just specifically heart disease. And if you just look up on PubMed, which anyone can do, just put into the subject plant-based diets and cardiovascular disease, which I did. I got 819 studies on this. So
wow.
Yeah, so let's go back. So what is some of the very early studies are some observational studies. One that's interesting, and Dr. Esselstyn talks about it a lot, is in Norway after World War II, during World War II actually, all the meat was taken, when they were taken over by the Nazis, the meat and the animals were taken away and returned after the war. And what people noticed is that, and what was noticed when they looked at death certificates, is that the amount of death from heart disease dropped precipitously, which is a strange thing. While they couldn't eat meat. And then as soon as the meat was returned at the end of the war, then the heart disease risk went up again and the death from heart disease went up.
Who knew the Nazis were such into health?
Health, all right. I like to think about that, but it's one sort of strange thing. In Africa, Dr. Burkitt was studying, and actually he's the father of fiber, but he was noticing as he was working in rural Africa that not only was there no heart disease, but there was also no colon cancer, diverticulosis, and all the things that were helping. And they did some studies actually comparing, more with colorectal cancer, comparing Americans with Africans. But it's amazing how many consecutive autopsies they did. These were not young people. These were older people, and they just did not have heart disease because of their diets. Rural China also has been studied, and Italy with this with Ansel Keys and his 7 countries trial also. He was very interested in the Mediterranean diet, also noticing much less heart disease. So there were some early observation studies, and then there were some early cohort studies where they take large numbers of people and they just follow them over time. One that you may have remembered is the Framingham study from Framingham, Massachusetts is ongoing. The Nurses' Health Study is another one that's also ongoing. The Health Professionals Follow-Up Study, which is just looking at men, also is ongoing. So these are some early cohort studies, but they definitely showed lower heart disease risk when people were eating more of a plant-based diet. There are some early pioneers. So Lester Morrison was probably earliest. He was very motivated by the Norwegian study that he had heard about, and he started treating his own patients with diet. So he's a very early pioneer. And then Nathan Pritikin in the 50s was interested in, I think he knew about Lester Morrison. He put himself on a plant-based diet to reverse his diet. Now, he is not a doctor. Nathan Pritikin was an engineer, but he had heart disease and he reversed it himself. He actually started publishing books about the Pritikin diet. You might have heard about this. Was in the 70s. One of the outcomes of all of this was, of course, Dr. Greger, because Dr. Greger's grandmother was one of Nathan Pritikin's death's door people who had so many surgeries and procedures that she couldn't have anymore. She was sent home to die. She was only in her 50s, I believe. And she lived another 32 years being on the Pritikin protocol. And his was a very low-fat, whole plant food diet and with exercise. Then there have also been large population studies, and some of these are also ongoing, like the Epic Oxford, the Adventist Health Study, the Adventist 2, and the China Cornell Oxford study as well. So large population studies. There are also these metabolic ward experiments where you put people into a room or an apartment and you feed them and you watch what happens. So when people talk about, well, eggs don't raise cholesterol, well, they do. They absolutely do. They've tested it. You know how LDL cholesterol is affected by saturated fat. It's not a mystery. And despite the ongoing advertising of meat, we do know the truth. So it's very clear. And then there's some very important individuals that I want to talk about even in more detail. Dean Ornish and Caldwell Esselstyn Jr. And now, of course, even more doctors are doing this. All of Kaiser is really working on this, and they're doctors in New York, like Robert Ospel you just went to see, and Michelle McMacken, and just all over it. Many, many other doctors are using diet and lifestyle to reverse heart disease. But one of the very earliest ones was Dean Ornish. So there's so much data now that our past president of the American College of Cardiology, Kim Williams, actually said that there are 2 kinds of cardiologists, vegans and those who haven't read the data.
It's true.
It is true, although there are still cardiologists in my community that are promoting paleo. Dean Ornish took a year off of medical school to do this study, which was then published in a very prestigious journal, The Lancet, in 1990. He took people who had heart disease, he randomly divided them into 2 different groups. He had a control group that were able to do what they wanted, eat what they wanted, and he had his study group, and they were on a low-fat vegetarian diet with some non-fat yogurt, non-fat dairy allowed. It was 10% fat, so a very low-fat diet. Moderate aerobic exercise, 30 minutes a day, stress reduction, either yoga or meditation. They were advised to stop smoking, and they had some group support every week. And they were followed for 1, and then again, they were followed for 5 years. And these people had to agree to angiograms to show the changes. So here we have the results. And here you can see, this is the change in the diameter of the coronary arteries. And really the results were dependent on how adherent the people were to the program. So the most adherent got the most, and I know it doesn't seem like very much when you're talking about just a percent, like negative 6 or 7% change, but when you know that the flow through a tube is dependent on the 4th power of the diameter, then even a small amount affects flow very greatly. This is really comparing the control group, and you can see the natural progression of the disease, if you do nothing, is that it just gets worse and worse. We've changed the x-axis now, so it says the percent of stenosis, of closure, right? So now we see a progression of the amount that it's closed, so much so that some of the people in the control group who were just doing what their doctors told them to do actually needed stents and procedures, whereas nobody in the treatment group needed any kind of procedure in the 5 years that they were followed. And you can see that they continued to improve. So this was very, very important. Now, this is Dr. Esselstyn's work, and he did another study. He didn't have his separate control group. He used his own patients as their own control group. So he took patients who were basically also end-stage heart disease, nothing else the doctors could do for them. They were having many, many events, like, either angina or chest pain or couldn't walk well. So put them on a very strict diet. Now, his diet is a little different. So it's completely vegan. It's also very, very low fat. I don't think at the time there were no nuts and seeds. And now he's liberalized a little bit. But in addition, because he really believes in the power of that endothelium, it's all about the endothelium, that he wanted people to have more nitric oxide. So he wanted people to have some lightly steamed greens 5 times a day. He didn't care about it. I don't think he had made them exercise or support groups or anything else, but it was the diet and the steamed green. And look what happens after 32 weeks. This is really amazing. I think everyone can really see the kind of blockage on the left and what happens after 32 weeks. This is the same patient. So all of the patients in his group, and they've been followed for almost 20 years now, everybody who has been compliant with his program, nobody has needed any procedures. No one has had any issues with their heart at all. There was one person who strayed and he started to have problems and he came right back and he got back on the program and did well. So,
heart disease is an absolutely toothless paper tiger.
That's just what I was going to say. Yeah. Heart disease is a toothless paper tiger that need never exist. And when it does exist, it need never progress. That's what Dr. Esselstyn says.
Yep.
And he's my man.
He is.
Also came from a dairy farm, right?
He did.
Yeah, Esselstyn and T. Colin Campbell both came from dairy farms, which is so here I like this. Where do you get your protein? The lion says to the rhino, not this idiot again. It's just to say, when you think about, I need meat to be strong, but actually you don't need meat to be strong. You need plants to be strong, and all protein comes from plants. And all these big, strong animals make all their protein from plants. Epigenetics, how your genes are not your destiny. This is so important.
You mean they're not?
No, actually they're not. And this is really fascinating. And I didn't know much about this, and I've just been learning, and it's really opened my eyes. This was something also that I didn't know when I was in medical school. We've just started to learn this the late 20th century, in the 90s. So when you were in high school, you would learn Mendelian genetics. And do you remember Mendel was this monk? He was working with pea plants and playing around with them and getting changes in the plants based on very simple way of thinking about getting one chromosome from one parent, one chromosome from the other parent, and some genes are either dominant or they're recessive. And so a good example of this is blood type. If you inherit type A blood from one parent and type B blood from the other parent, your blood type is going to be AB, and nothing is going to change that. And it doesn't matter how much you smoke, you're not going to change it, because that's not something that can be changed with epigenetics. Epigenetics, though, is very important for thousands of other genes that are coded on your chromosomes.
I think Neil Barnard talks about them like being committees.
Yes, right.
And they're going to decide whether they're going to express or not,
Right. This is interesting. So think about, for example, I'll give you an example. I thought this was a good example. You'll have to see if you agree. So every nucleated cell in your body has the same chromosomes, the same base pairs. But what actually gets expressed is very tightly controlled. You have salivary glands, they make amylase, right? Amylase is to dissolve sugars and to simple carbohydrates. In your stomach, those cells make hydrochloric acid. The cells in your cervix are making mucus. They're goblet cells that are making mucus. So they all do different things, but they can do anything. So what if the gene for hydrochloric acid was turned on in your salivary glands?
That would be annoying.
It would be, because if you kiss someone, then their lips would dissolve. So it'd be nobody would like you. It'd be very, very bad. So you can see how important it is that cells are turned on or not turned on. They're either suppressed or they're expressed. And it's very tightly controlled. It can go wrong, and it can be affected by diet and lifestyle. That's what's so amazing. So how is it done? We do know a lot about this now. So one way is through something called methylation. They add a methyl group to part of the DNA, and then it can get expressed or not expressed depending on where it's methylated at the beginning of the gene, in the middle of the gene. Another way is something called histone modification. Histones could be thought of as spools with the DNA sort of wrapped around the spool. When it's wrapped tightly, it can't be expressed, but the histones can be modified, adding like an acetyl group, a different kind of group to it, and they can change the configuration of the spool. Maybe parts of the gene are then unraveled and they can be expressed. So this is how it happens.
Wow.
Yeah, it's pretty amazing. And here it is at work. So Dean Ornish, after he was able to reverse heart disease, he went on and he showed that you could reverse early stage prostate cancer. And how this relates to epigenetics, I will explain. So he took the same diet, right? He took a low fat, but this time he used a completely plant-based diet. He took people with early stage prostate cancer, people, early stage means men who are going to be followed. They don't need to have surgery. They don't need to have radiation at the time. They're just being watched, just watch and wait. So he took these people, but he had them on his same kind of regimen, 11% fat, plant-based diet, completely plant-based, moderate exercise, 30 minutes a day, stress reduction, and a support group. So they either did yoga or meditation and a support group. And what he found, he followed them at 1 year, but he also followed them also at 3 months. Their PSA dropped and their tumors decreased in size at 1 year compared with the study group. So the other group, the people who were told to do what their doctors told them to do. Really hate to say that. It's really terrible to think that if you do what your doctor tells you to do, you're going to do poorly. Really terrible. But
I know, but because doctors are not educated.
They're not educated. And I know that Michael Clapper is really making an effort this year, next year also, to go all around the country speaking at medical schools. This is really something that he's promoting, because we have to get to people. But a lot of the older guys, they just don't know. So in the group that was doing what their doctors told them, actually a number of them needed surgery in the year. They needed procedures done. They needed treatment because the disease had progressed.
Wow.
So this is what's so amazing. What Dr. Ornish was able to show is that in his study group, over 500 genes that are linked to breast and prostate cancer changed expression. 453 genes that promote cancer, like the RAS, the RAS oncogene, were downregulated, and 48 genes that protect against cancer were upregulated. And that was after just 3 months.
That is just so incredible. I can't begin to say.
I know. What's more incredible, one, is that so many doctors don't know this, but two, that patients, people that I know who have early stage cancer, are not willing to do it.
I know. I don't understand that. I just don't understand. You know something is bad for you, but yet you continue to do this. I don't.
It must just be basically an innate human, just something about us.
Well, I also think the food industry has really, hijacked our brains on so many levels.
There's just an addiction to food, right? Just an addiction to food.
True addiction.
Yes.
That they can't give up whatever, X, Y, Z. I mean, cheese in particular, because that's, we talked about that, having the casomorphines. So.
Right. All right, let's go on, because I thought this was really particularly important, especially as I'm an obstetrician, as we're going to be working on this program, the pregnancy advantages. So how would epigenetics affect my children and grandchildren? So this is Project Ice Storm, and I welcome, please look this up, because it's fascinating. I've been studying these people for almost 20 years now, and it's ongoing, 19 years. At least. So in 1998, there was an amazing ice storm in Quebec. It was minus 20 degrees. People lost power for up to 40 days. They were stranded. Yes, it was just it was chaos. It was horrible for people. There was tremendous social stress. And there were women who were pregnant during this time. So they decided to study the offspring of women who were pregnant during this time. And they were able to look at how they thought about their stress that they were under, and also their objective stress, like how long they lost power and everything. I don't know all the details, but there was objective stress and subjective stress. And what they found, they've been following these children for up to 19 years, and it is ongoing, is that there's more autism, more metabolic disease, like diabetes. There's more autoimmune disease as well, with increased maternal subjective and objective stress. But hundreds of genes changed expression. So especially when they were looking at the objective perinatal maternal stress, it altered the expression of hundreds of genes that regulate the expression of stress hormones, like glucocorticoids, and also immune cells. So you can see that your offspring is really going to be affected by this. I didn't know this. I didn't know this. When I saw women, when they were pregnant, and they'd be crying about stresses that were going on in their lives, and they'd say, what's going on with me? Is this going to affect my child? And I didn't know. Honestly, I'm coming clean here. I didn't know. And I thought what mattered is how you behaved around your child when the child was born. And, if you were going to be loving and able to hold and nurture and all of that. I didn't know about any of this. It wasn't just the milieu, it's really the genetics. And not to mention, you're changing the gene expression in the children. You're also changing the gene expression in their germ cells.
Wow.
So their children, if they don't do anything to change that, that's going to be carried on to the next generation as well. They're going to have a different response to stress in their lives. Yeah, it's sad. So this is why we want to make people into the best shape possible to be pregnant and during their pregnancy as well. So your take-home messages, because I want everyone to be as well as possible. The take-home message are for a long and healthy life. Center your diet around whole plant foods, get regular exercise, manage your stress. And along with that, I would say it's very important to get restful sleep, at least 8 hours a night, or not too much more either. I mean, it should be about 8 hours a night that you need for optimal brain rejuvenation and regeneration, and maintain a healthy weight. And do not smoke. There are many things, chemicals that we're exposed to that we cannot change. Many of us live near highways and there's not much you can do, but there are some toxins that you can avoid. And one that's very, very important is cigarette smoke.
Not just that, but there's this new vaping,
oh my goodness, right.
I mean, we're starting to see this in schools. We're starting to see a lot of this in teenagers that think it's so cool. And the amount of toxins in one little package of the vaping material is equivalent to a package of cigarettes.
Wow.
And that stuff can be just inhaled.
Deadly.
Wow. I mean,
right.
I constantly see on Facebook, people posting like their kids in the hospital, they're trying to find lung transplants. I mean, it's just incredible what this vaping is doing.
Right. No, I know. And it's not just the vaping material that's cut with THC. It could also just be the nicotine itself. We don't really know, right? There's something that they're putting in it to vaporize it or making it into your lungs. We don't really know, but I would definitely stay away from anything that you inhale into your lungs. And that goes for pot too. It's not good to put anything into your lungs that way. I mean, there might be benefits to using cannabinoids in some way, and we were learning more about it. And I'm not anti-cannabinoids by any means, but in terms of inhaling something into your lungs, I don't think you need to. Oxygen.
Well, I just want to end with, when I was teaching biology overseas, I couldn't do this here in the United States, but when I was overseas, one of my parents was a surgeon. And I asked him, because when the kids wanted to see, I was teaching biology at the time, and the kids wanted to see a dissection. And I just have been anti-dissection from day one. I mean, why, kill animals just so I can cut them open so you can see the insides? There's a lot of other ways we can learn that, the inside of an animal, without having to kill it and then cut it open. Right. But anyway, so the kids were real adamant. And I said, okay, I'll take you to see a real dissection. So one of my parents was a surgeon. And I said, would you do an autopsy for me? And he said, sure. I said, would you find two bodies? I want to see one that was relatively young, died of like a car crash or something like that. The upper chest was still pretty intact and it was a healthy person. Then I want to see somebody who's died of like tuberculosis or, cancer of the lung, something like that. And he said, okay. And it wasn't too long before he had two bodies and he called me up and said, okay. So I took the kids and we went to see an autopsy, a real dissection.
Wow,
and the kids went in and we saw the lungs, when they opened it, the first person who was relatively healthy, the lungs were pink and spongy and soft and beautiful and the correct size. And then when he opened up the guy who had died of lung cancer and smoked for like 35 years, the smell that came out of his chest, everybody was okay watching the dissection, the autopsy of the first guy. That went okay. Nobody lost it. Nobody tossed their cookies. Nobody fainted.
Right.
But the second guy, everybody was gagging, and including myself. I mean, just like, oh my God. His lungs were like, I don't even think they were a third of the size of a normal lung. And they were black as black could be. It was almost like hard, almost like a rubbery texture.
Sure, there's some fibrosis, right, from the chronic inflammation. Amazing. Yeah. You're an incredible teacher. I'm glad that you were able to do that. That's incredible. That's really valuable for students. I bet you if not one kid in that class smokes today, right.
if I could follow
sure it's
them.
Up to you. Right. So. No, I'm sure that was something. I mean, that's why we feel if kids actually had to go to slaughterhouses, right? And actually had to see where their hamburgers come from. I doubt they would eat that either, or their chickens. Right. I don't think anyone would be able to handle that. No. My hat's off to you. When I was young and I was in college, I actually didn't have the wherewithal to know that it was wrong to cut up animals. And I'm always amazed when I hear Dr. Neil Barnard talk about that he just knew. I was really late to all of this. I was a late bloomer in terms of veganism. I was excited to learn, and I was just being selfish, and I didn't know. By the time I was in medical school, we had dog lab, which was terrible. And in a residency, we used a pig to learn how to do laparoscopy. So I apologize to the universe. It was really terrible. I didn't know, and now I do.
Well, and now you're sharing it with the
Right.
rest of the world.
Right. So I think
So,
people can now know that you can change and you can develop your ethics and your ability to see that you can look on the right, that the pig and the dog, there really are no difference. And the same with a cat and a chicken. All the animals want to live and deserve to live free of pain and fear. So especially for humans. I mean, all this is about for humans. I want humans to live without pain and fear also, right? This is why I went into medicine, and this is why I went in. Now I'm trying to promote plant-based medicine as well and lifestyle
well, and
medicine.
we want to help people to change before they get pregnant. And before you
Yes.
consider getting pregnant, you want to get your body pregnant ready, get the toxins out of it, get your body ready to receive the sperm and fertilize that egg. So, yeah.
And be a healthy weight, because actually we know that when women are developing children inside of them and they're obese and they're eating a very poor, high fat diet, you're knocking IQ points off of your children. And that's just not right.
You can connect with Dr. Shapiro at New View of
Please.
Food at deborashapiro1@gmail.com. And
Yes, you
there's
could
her
write to me.
number.
Yes.
So she's
And
got all kinds of ways. You can contact me through simplyplantbased.net. So, and coming soon will be the Pregnancy Advantage.
right. I do have an ebook that you can download. Just go on to newviewoffood.com and there's a little ebook and you'll be on my mailing list, and it's called Why Eat Plants, and you might find that interesting as well.
Thank you, Dr. Shapiro, for taking the time to share with us this amazing presentation. You are a rock star. Thank you.
Thank you so much, Jean. I have the highest regard for you, and you do amazing work. Thank you so much for everything you do for people. Thank you. Thanks for having me on.